Hello, welcome to another video, and today is sort of like a follow-on from a video I did a while ago about some interesting stats and statistics about knee pain. So today I thought I'd make it more about back pain. There's an endless amount of stuff we could talk about, but I just wanted to go over some of the common things. So firstly, how common is back pain? So 9 out of 10 adults are estimated to experience back pain at some point in their life, where only colds and flu beat low back problems for a doctor's visit. It's first according to the global burden of disease estimates, ranked first in Australasia, so Australia and New Zealand. And around 4 million people in Australia were estimated to have back problems in 2022. In 2021, there was a lot of money spent on trying to treat and manage back pain. I'm just playing this video here so to give you an idea of, this is the most common sort of way back pain is usually produced from bending poorly, which we'll get into in a minute. But just to give you some of those stats, which were quite compelling, it just shows you how, even with all the physiotherapists and osteopaths and personal trainers and massage, all the stuff that we'd never had 100 years ago, like the technology, the expertise, this is still such a massive problem. So, and a lot of the times there's other things associated with it. So, for example, it's estimated to be about 2.5 times likely to have poor health overall if you have back pain, 2.6 times likely to have high levels of psychological distress, 2.5 times to severe or very severe pain, and 3.5 times to have some sort of other problem as well, some other self-care or mobility restriction associated with the back pain. So it is a huge problem. So I think a lot of it could be, or not a lot of it, most of it could be prevented from just better understanding and knowledge of what you need to do to look after yourself, and being mainly the first thing about moving well, which I spend a lot of time in most of the videos talking about that. And this exercise, for example, this is a deadlift where I've got like a band assisting like a weak side. So it's sort of and I use this a lot for lateral pelvic tilt, sort of like forces the weak side into working harder. So it's actually mimicking the action that there would be pain. So obviously before you're lifting a weight like this, you'd be doing it with just body weight, learning the mechanics and the position and alignment. But once you're through that part but you're not fully rehabilitated, you need to regain your strength. These type of exercises are excellent. But usually people don't do this, and what they usually do is they do too much resting. So we'll have a look at some facts about that. Okay, so the most common thing that people do when they've got back pain is they rest, which is a good thing. At first, it allows the body to heal itself, but if you do it for too long, it actually makes matters much more worse, and also helps to explain why people feel really the worst first thing in the morning after sleeping, and especially if they have a disc problem. And this is the reason for this is the body rehydrates the discs overnight by filling them up with a concentrated protein that's like a water-like substance, and basically that's how your discs get their nutrition to remain in good health. So obviously because that happens, they'll swell to a larger size, which is okay if you're have a normal sort of shaped disc, or it's normally positioned well, so it's not close to the sciatic nerve. But if it's in a bad position and you have bad movement mechanics, it means it's going to be, when it swells, it's going to be touching that nerve. So then when you try to move, like, it's excruciatingly painful until those discs sort of shrink in size once you start moving after 10 to 15 minutes. But so the thing is to understand that a person who has good alignment and good posture and good movement mechanics, that swelling of the disc is not a problem to them. It doesn't make them stiff and awkward. It only does for the person who's not moving well. Which brings me to what the second thing people do after they've been resting for too long, they just start doing stretches. Now, stretches aren't necessarily bad entirely, but if that's all you'll do, you're really not going to be helping yourself that much, because most of the time, so Dylan here is demonstrating some stretches, although this one's quite an advanced one. So the problem with stretching is it doesn't address the weakness, so that's going to be the underlying problem, and you have to really try to use your mobility exercises in combination with stabilizing and strengthening ones. Otherwise the stiffness is just going to return, and even worse than that, the way you moved in the first place that created it all is still going to be used until you've shown a better way, which is why we would use that deadlift that I showed at the start, because the trigger of the problem is actually what you need to change, and until you've changed that, you're never going to get anywhere. All right, so then brings me to like this, where a lot of people make the mistakes of stretching too much. And they're sort of looking for spinal mobility instead of spinal stability. All right, so in the case of what he's doing here with the foam roller, I don't mind this so much because it's trying to release some sort of trigger points and stiffness. But again, it's completely useless if he doesn't work on the strengthening of the opposing muscles that are to the stiff ones. So now when people start to try and overstretch themselves and and especially like trying to do roll-up exercises that you would see in Pilates a lot, they are terrible exercises for spinal problems, because basically your body, when you have a back problem, it's not looking for more mobility, it's looking for less. All right, so this exercise here, this is really a hip loosening exercise so that you don't buckle at the spine. So usually if the hips are too restricted, that's what's going to be forced upon the spine to make up the lost range of motion. So what he's doing here, his spine is still in a neutral position. He's just trying to get some mobility in his through his posterior chain. Now, if you're constantly trying to like bring in spinal flexion or even extension, which is again what you see a lot in the Pilates type things and even in yoga, you're really going to create a ton of problems. And I'll put a quote up here from McGill about what he thinks about that. And I've seen exactly the same thing with many people who have created their back problem from yoga or from doing sit-ups even as well. So, so it's a terrible exercise when you have back problem. It's only just going to make things worse, not better. And if you play sports, even more so, which I've seen this being done with professional athletes before. So, all right, so then brings this on to our next point about core strength. So if we need stability, obviously core strength needs to be used. So let's have a look at that. Okay, so with core strength, this is really like where there's some good exercises turned bad. So this one here that Dylan's doing is really like a hip extension, so testing gluteal strength as much as oblique strength on the opposite side. So I use this as a test a lot, but there might be a lot of other ones that are specifically core orientated, but again, this is where a little bit of information that's not understood well can really turn something good into something bad. So the main thing to understand is how much strength do you actually need, and this is where people are trying to annihilate their abdominals like they would with any other muscle group, thinking that, okay, if I just hit it with tons of work, it's going to get better. Not necessarily true. So I'll use McGill's research again for this. So he found that to maintain a safe amount of stability with most tasks, it's more important to have great muscle endurance than peak individual strength. So what they found was having strong abs didn't necessarily provide the stability effect they were looking for, yet muscular endurance did. So what they found was you only really needed about a 10% of maximum voluntary contraction depending on the task, but doesn't sound like a lot. But what they found was that there were sort of three things that were more important than just the total strength, and that was his ability to fire fast enough to provide stability prior to the body moving. So the TVA, for example, is known as a feed forward muscle, so it really is contracting well before you've even moved any of your arms and legs. The second major point was the co-contraction of the abdominals with the back extensors. If you had really powerful abdominals but really weak extensors, you still were going to be exposed. And I think that's another area that people just don't pay attention to. They just focus so much on the anterior abdominal muscles, they don't really pay enough attention to what their back extensors are working with. The third thing was the muscle's ability to maintain strength for the long periods, which is what we spoke about a minute ago. So I think what Dylan's doing here is like a kneeling deadlift, just trying to learn position so that when he stands he doesn't like lose all control. But this next exercise, which is most people refer to as bird dog or horse stance or quadruped, whatever you want to call it, doesn't really matter. This is an exercise that does do all of the three things that we spoke about. So especially when you add a band to it like this, so that's where you're forcing the abdominals and the back extensors to work at the same time, and they have to fire well before. If you've ever done this exercise before, you'll realise how difficult it is when you add a band to the leg, because the minute the hand comes off the ground, like your abdominals will light up and you'll see you lost a bit of control there. And even better than just the abdominals and back, you've got glutes involved. So remember, glutes are a real huge problem to low back. So this is such a great exercise, really underrated. And again, you'll see how the spine is being asked to just remain in neutral, not to use flexion and definitely not to use extension, just to stay in neutral while the arm and the legs move. So it's an anti-movement type of muscle group, and that's how it should be trained, as opposed to doing things like with sit-ups and stuff like that. They are not going to help your spine improve. They're only going to make it worse. All right. So let's. So the other thing that a lot of people would do, that if they've done resting, they've tried stretching, then they think nothing else can be done. So they've done none of the exercises we've looked at here. That's when they think they must need surgery and and moving to spinal fusions and things like that. So again, like these are not a good option. If you've tried every other avenue and exhausted all your other options, well, maybe you could look at it, but even still, I'd say maybe you haven't done some things correctly. And I'm not just saying this I've worked with maybe 40 different type of people with spinal fusions. I have yet to meet one that's really just moving really good and with no pain. I've yet to meet that person. I'm sure there's some out there, I've just never met one. So I'll put some interesting quotes up about that that you can see here. And these are from 3 different sources. Again, McGill, because I rate him highly just because he spent nearly 40 years now working just on back pain, and testing and EMG studies and working with in a clinic with people like me, but on much bigger scale than I have, from professional athletes to average people, or all age groups. He really has looked into it a great deal, and I'll put that quote up there so you can see what he thinks of it. Then there's other doctors. So another one from a book called The Surgery, the Ultimate Placebo by Dr. Ian Harris, an orthopedic surgeon in Australia. This is his quote. So again, very poor outcomes, which is why, I've never really seen anyone better. Do you know what I mean? So, and the last quote here by Dr. David Hanscom, again, in a US surgeon, it just shows that there's not really a good outcome. You really need to be learning how to move well. So, really learning how to do things like this, and obviously in a standing position, learning how to just get more control and strength at the hip and less, you want to be able to have the ability for your spine to flex and extend. You just don't want it to be repeatedly flexing and extending. So you definitely wouldn't want exercise that encourages it. And if you're in a sport or something that needs it, then you need more training that counters it. If you're in an occupation that's sitting all day, you really need to be aware of the possibility that you're going to end up flexing or overextending. It's not bad luck that people get these injuries. It's repetitive habits and ignorance and neglect of what they needed to do to maintain a healthy body that creates them. So anyway, we could keep going for hours on this. I just wanted to share some interesting stats and facts, things that I see a lot and things that are supported, when you look for it, but it's not common knowledge. A lot of the common knowledge is not really based on all these things, which is unfortunate, which I think is why it just becomes so common. So anyway, I hope I haven't rambled on too much and give you some things to think about. And I might do the next one about shoulders, because it's shoulders and elbows, because they're another really common area that I see a lot, again, from bad repetitive habits and ignorance to looking after those joints. So anyway, I hope you've enjoyed that video, and we'll see you on our next one.